can composing and performing in music therapy actually work? And what if you're not a musician? Can you really still benefit from those other aspects of music therapy, like playing and performing?
Well, I'm going to start with the performing aspect first and just talk a little bit about a group that I do, which is a singing and wellness group that I run for persons with cancer and cancer survivors. So this is something that I've actually been doing for about the past 4 years, and these groups run approximately for 8 weeks, and people sign up and attend. And they're called Singing and Wellness, and it's about coming to sing to improve your health. And so most of the people that actually sign up for these groups have very little, if any, experience with singing. They are highly doubtful about the treatment effects that they are going to experience, but they just sign up because they want to try something different and maybe have a good time. And so the most recent group I run, which actually ended yesterday, I asked them, I said, you know, how do you feel that this singing group has contributed to your health? And I just want to tell you some of the things that they said to me. And they were so passionate and they were so adamant that this was contributing to their health in such a positive way. And they were so shocked at how they felt about this group, even after this short period of time. So they told me that as a result of participating in this group, that they felt less anxious, that they felt more energetic. A couple said that they actually took less pain medication after the group. They said that singing took their minds off of their illness and stopped all the repetitive negative thoughts, so that they could just stop thinking about having cancer and what that meant for them and what that was doing to them. They could take time away from it, focus on this other thing, and gain some perspective. They experienced great joy. And a lot of them hadn't felt that kind of joy for a long period of time. They said it felt like a runner's high. They would leave that group just feeling like they had overcome something. Some of them said that they felt that they had positive results. They're experiencing some throat issues as a result of their treatments, and they felt that the singing actually helped that as well. It gave them confidence. And it said that it gave voice to their cancer experience, and it made them feel like they were really living their lives and that they felt more alive. So I think that their words really speak to that.
Heather, being my comrade in cardiology, we're very hardcore evidence-based. So I'm going to ask you, Heather, also being the musician you are, do you think the benefits that Laurel was talking about with the mind, that Heidi was talking about with clinical outcomes and mood, or Laurel was talking about in terms of her anecdotes, do you think that all we're seeing here with music is a healthy placebo effect?
It really doesn't matter why, I don't think. It's the fact that it does have a benefit. And part of that, and why a placebo works, has been an area of study. Is it the doctor-patient relationship? Is it the interaction, the trust, the confidence that you have in the doctor giving you the medication that makes you feel more positive towards a good outcome? Is there something about the healing? Does it happen in every environment? And it tends to lead you towards the issue of optimism, if you will. One of the most important things in medicine is the establishment of a doctor-patient relationship, a therapeutic relationship, and a trust relationship. That issue is patient-specific and doesn't work for all patients. But the issue of optimism has been studied in the Women's Health Initiative, actually, which was a study of 97,000 women. And they actually did a specific questionnaire to see if you were a half-full or a half-empty person. So if you're a half-full person, if you're an optimist, if you believe in a positive outcome, versus an absolute cynic or a complete, not even half-empty, but a complete empty person in terms of a cynical outlook, the optimistic outlook, so the highest and most optimistic outlook for women, the women who had that outlook, had a much lower risk of dying from heart disease, of dying from cancer, versus the cynics. Now, that hasn't been studied in men, but it comes back to this issue of a placebo and a positive and an optimism, and does it really matter why? Doesn't it just matter that it is?
have any of your patients utilized music in any way as an aid to their care?
It's an interesting story. A colleague of mine was involved with a patient, and the patient related a story. The patient had deep faith and had terminal organ failure and was going to die without a transplant, and had come to some sort of peace about the concept of dying, and was obviously a person of some faith. The call came that an organ was available, and the patient came into the hospital to receive the organ and met the surgeon on the way to the operating room, and just happened to ask the surgeon, "I've heard that sometimes in the operating room you play music." And the surgeon said, "Well, yes, actually, that's true. Is there anything in particular that you would like to listen to?" And the patient thought about it and said, "You know, a Love Supreme." And it so happens, and this is a true story, that the surgeon had John Coltrane's A Love Supreme in his pocket. Pulled it out of his pocket and showed it to the patient. And the patient recounts this story with an incredible feeling of when that CD came out of the surgeon's pocket, the patient knew beyond a shadow of a doubt that he was going to survive the transplant, which he did, obviously, because there is this story. And this is not the only story. I have had patients who've asked for specific music to be played during their transplant operations. And many times in the coronary care unit, in a patient who's been critically ill, the family has brought in specific music for the patient as a way to try to encourage wellness. Music associated with memories, getting back into the limbic to try to bring the patient back. Patients who've had cardiac arrest, whose hearts have stopped. And also, we've had a great deal of use of music in the palliative care or in the setting of terminal patients to try to bring peace, much along exactly what you've been talking about with music therapy.
Now, one thing I would like to bring up, one interesting sort of more spiritual effect that I had personally with music that had nothing really to do with my own personal health. I've been a camp doctor for over 20 years, and and about 2 years ago, our camp was afflicted with a norovirus. Now that's a Norwalk kind of virus, so all the kids were throwing up, projectile vomiting and diarrhea, and it was rampant in the camp, and everybody was really sick. And the spirit of the camp was terrible. The counselors were working day and night trying to clean everything over and over again, as well as look after the kids and try to provide an enjoyable environment for them, despite the fact that everybody was so sick. Now, at our camp, one of the mainstays of the camp is the spirit, and part of the spirit has, in our dining hall, there's always music. It's the fun part of the meal, like when the music comes on and everybody gets up and dances and sings, and it's really quite pleasurable. My wife, Cheryl, who's a psychologist and a musician, by the way, we were sitting at our table during this outbreak, and we realized that there wasn't any music. We hadn't really been paying attention, but we noticed that she turned to me and said, "Where's the music? Why aren't we hearing it?" And what had happened was that everybody had become so, I guess, so overloaded with how heavy this virus was, and everybody was so sick and tired that they just stopped playing it. So she suggested that I go over to the camp director and turn the music back on. I went to the director and I spoke to him, and he said, "Geez, we just didn't realize it." So they did. They turned the music back on, and within minutes, there was such a palpable change in energy. The whole room lit up. The kids started boogieing to the food. They were dancing. Kids in the corners were standing on the table and doing their cheers again. It was unbelievable. I have to tell you something fascinating was that virus was gone in 2 to 3 days after the music started. The spirit of the camp clearly improved, and all of a sudden everybody was happy again, despite the fact that they were living with us. And then it was gone. And in fact, the second session, there was no virus.